Well, melanoma is the deadliest form of skin cancer, and in San Francisco, a clinical study is being conducted on an investigational drug. Now, with details on the study is my next guest. She's Dr. Lynn Spitler, founder of the Northern California Melanoma Clinic at St. Mary's Hospital, or St. Mary's Medical Center in San Francisco. Thank you for joining us today. And when I introduced this as being melanoma, which is the deadliest form of skin cancer, correct?
That's right. That's right.
And there is this worldwide study that's happening at your hospital. Tell us a little bit about the study.
Well, the problem, you're correct in saying that melanoma is the deadliest form of skin cancer.
Okay.
And it's a disease that strikes young adults and who've always been healthy all their life. The treatments that we have for it are not very good. There are only 3 drugs approved by the FDA for the treatment of melanoma, and none of them are very effective in treating melanoma.
Truthfully, whenever people hear that someone has melanoma, it's almost like a death sentence. Is that bad?
Well, it is. If you find it early,
Okay.
80% of melanomas are cured by finding them early and by surgery. The ones that we see and the ones that are candidates for the clinical trials are those where it has spread to other parts of the body. So what happens is that my background is in immunology, and I've been doing clinical trials with melanoma for over 30 years.
Wow.
And the standard kinds of treatments that we have for other cancers, like chemotherapy, don't work well for melanoma. It's a disease that seems to respond to immunologic agents. So our focus is in that arena, and that's where the successes are coming. The trial that we're doing right now is a very interesting one. It involves injecting. Melanoma spreads, you can get nodules of melanoma in the lymph nodes and in the skin. And what we do is we're injecting a virus into these nodules, and that virus enters the melanoma cells and causes them to break down. And it's genetically engineered, something we could never do before. It's genetically engineered so that it's specific for the melanoma cells and does not harm the normal cells.
So it just breaks down those the cancer cells.
The melanoma cells. Well, that would be okay, but the problem is also that melanoma spreads to other parts of the body, lungs, other places where you can't be doing injections. So this virus is genetically engineered to also enhance the immune responses. It produces a substance called GM-CSF at the site of the injection, and this GM-CSF increases the immune responses to the patient's own tumor.
So it does 2 things.
Yes.
It takes care of the melanoma cell, it breaks that down,
yes,
as well as boost your own immune system.
And boost your own immune system so that tumors that are someplace else that we can't inject also go away.
So this is a trial study with this investigational drug.
Yes.
And from what I've read, that means that this is not a drug that's been FDA approved.
That's correct. It's done with the, it's not approved by the FDA for marketing, but it's done under guidance, FDA guidance.
So it's gone through all the other testing and all the animal trials and everything else.
Yes.
Now it's for human consumption.
Yes.
On a trial basis.
And it's been through early clinical trials in patients too, with very promising results.
So if people want to sign up for this, what qualifications must they have before they can be considered as a patient? Patients
that are candidates for this trial have to have melanoma that's been proven by biopsy, diagnosed at some time in the past. Doesn't need to be a new diagnosis. And they have to have nodules that we can inject. So some patients with melanoma, it's only inside and there's nothing to inject.
Oh, I see.
So we have to have a nodule in the skin, in the lymph nodes, or someplace that we can feel that we'd be able to inject.
So this sounds like you have to have a relatively advanced case of melanoma?
Yes, these are patients who surgery is the best treatment we have for melanoma. But these are patients who are beyond surgical excision of their melanoma.
So if you volunteer and you're accepted, what happens?
If you volunteer and you're accepted, We would explain the trial in detail, give you a consent form, review everything that would be done, and usually it's things that are being done to follow melanoma patients anyway, like scans and blood tests and things like that. And this is a randomized trial, so you would be randomized to either get the virus, the genetically engineered virus, or another substance that boosts the immune response, GM-CSF. So it's two-arm study. It's a randomized 2-to-1 for the virus versus the GM-CSF. Both have potential activity.
But it's not necessarily a complete placebo. You
not
are
a placebo.
receiving something
Yes.
that will help yourself.
Yes.
Okay. And how many patients are you looking for?
We're planning to treat 20 to 30 patients at our center. We can treat more if we have more patients. We've, I think, treated about 10 so far. And there will be about 400 patients worldwide.
Worldwide. And one more question, how long does this trial program last?
We plan to finish accrual in about 1.5 to 2 years. And then we'll continue following the patient, continue treating the patients, and continue following the patients.
So do patients have that long of a time to sign up?
Sign up.
So it's not an immediacy right now.
Right.
Okay, so you just have to find the right patient.
This is going to be available.
Okay. Thank you for sharing the information, and we'll have all the information up on screen as we usually do, as well as online if you're interested and you want to share the information with others. But what we're going to do is take a short break right now, because when we come back, the Black Repertory Theater has a show you don't want to miss, and of course, it's all for a good cause. We'll have details. Stay with us.